Every year, thousands of lives are lost to suicide. But it doesn't have to be this way. With the right information and support, we can help prevent suicide and save lives. In this video, we will explore the warning signs, the resources available, and most importantly, how you can make a difference. So let's come together to fight this silent epidemic and help those in need. Remember, suicide prevention starts with you. Suicide is the act of intentionally taking one's own life. It is a complex and tragic issue that can have lasting effects on individuals, families, and communities. While the reasons for suicide are varied and complex, it is often the result of an individual experiencing overwhelming emotional pain and feeling like they have no other options. According to the World Health Organization, approximately 800,000 people die by suicide each year, or one person every 40 seconds. Suicide is the second leading cause of death among 15 to 29-year-olds globally. In addition, for every suicide, there are several more people who attempt suicide. The impact of suicide extends far beyond the individual, affecting families, friends, and communities. In the United States, the Centers for Disease Control and Prevention (CDC) reports that suicide was the 10th leading cause of death in 2020, with an estimated 48,344 deaths. The suicide rate has been increasing in recent years, with the highest rates among middle-aged adults, veterans, and indigenous peoples. Warning signs of suicide. With these alarming numbers, it is important to recognize the warning signs of suicide in preventing someone from taking their own life. Know that these signs can vary from person to person and may not always be obvious. However, being aware of the common warning signs can help you to take action to support someone who may be struggling with suicidal thoughts. Here are some warning signs of suicide. 1. Talking about wanting to die or wanting to kill oneself. When someone begins to express thoughts or feelings about wanting to die or kill themselves, it is a clear sign that they may be struggling with suicidal thoughts. This could involve saying things like, "I wish I were dead," "I don't see a future for myself," or "I feel like a burden to others." They may also talk about feeling hopeless, like there is no way out of their situation. Additionally, they may start saying goodbye to friends and family, or making arrangements as if they do not expect to be around in the future. This type of language should always be taken seriously and prompt the need for immediate action and support. 2. Increased alcohol or drug use. Substance abuse, such as excessive alcohol consumption or drug use, can be a warning sign of suicide. Substance abuse can worsen mental health symptoms and increase the risk of suicide. It can also indicate that someone is struggling to cope with stress, trauma, or emotional pain. If someone is using drugs or alcohol as a way to self-medicate, it is important to get them professional help as soon as possible. Substance abuse can also impair judgment and decision-making, which can increase the risk of suicide. 3. Withdrawal from friends, family, and activities. A sudden change in social behavior, such as withdrawing from friends, family, and hobbies, can be a warning sign of suicide. This may involve a decrease in communication or a lack of interest in previously enjoyed activities. The individual may become isolated and distant, which can be a significant red flag for suicidal thoughts or tendencies. 4. Change in sleeping or eating patterns. Significant changes in sleep or eating habits can be warning signs of suicide. This can include difficulty sleeping or sleeping too much, or significant weight loss or gain. These changes can be physical symptoms of depression, anxiety, or other mental health conditions, which can increase the risk of suicide. If someone you know has suddenly started to have difficulty sleeping or eating. 5. Anxious or agitated behavior. Agitation, restlessness, and irritability can be warning signs of suicide, particularly in someone who has a history of depression or other mental health issues. These behaviors can indicate that the individual is struggling with overwhelming feelings of distress and is unable to cope with their emotions. 6. Sudden change in mood or demeanor. A sudden change in mood or demeanor, such as appearing happier or calmer after a period of depression, can also be a warning sign of suicide. While this change may seem positive on the surface, it can also be a warning sign that someone has made a decision to end their life. This sudden shift can indicate that the individual has found peace with their decision or has come to terms with the fact that they will not be able to overcome their challenges. 7. Giving away prized possessions. If someone is giving away items that are important to them, it can be a sign that they do not expect to have a future. This behavior can indicate that the individual is making preparations for their death and is trying to distribute their belongings to people they care about. This behavior can be particularly concerning if it is accompanied by other warning signs of suicide. Suicide prevention tips. The thought of committing suicide can pop into someone's mind at any moment. But know that there are steps that you can take to help prevent suicide and support individuals who may be at risk. This includes: 1. Talk to the person and ask directly about suicide. Talking to the person about suicide can help to start a conversation and can show the person that you care and are there to support them. It's important to approach the conversation with empathy and to listen to the person without judgment. Asking direct questions, such as "Are you thinking about suicide?" can help gauge the person's level of risk and can give you an opportunity to provide support. 2. Encourage the person to seek professional help. Encouraging the person to seek professional help can be an important step in preventing suicide. This can include talking to a doctor, therapist, or counselor who can provide a professional assessment and develop a treatment plan. A mental health professional can help the person address their suicidal thoughts, manage their symptoms, and develop coping skills. It's important to support the person in seeking help and to offer to go with them to appointments if they would like. Encouraging the person to seek professional help can also involve connecting them with local resources, such as a crisis helpline or a support group. Seeking professional help is a sign of strength and can be a crucial step in preventing suicide. 3. Remove access to lethal means. Removing access to lethal means, such as firearms or medications, can help to reduce the risk of suicide. If the person is in imminent danger, it may be necessary to remove the means temporarily, such as storing firearms safely or keeping prescription drugs locked up. This can help to prevent the person from acting on suicidal impulses. In some cases, it may be appropriate to involve the police or a mental health professional to help ensure the person's safety. While removing access to lethal means is not a solution on its own, it can be an important step in preventing suicide and protecting the person's safety. 4. Stay with the person or ensure they are not left alone. Staying with the person or ensuring they are not left alone can help to prevent suicide by providing support and supervision. This can include staying with the person in person or ensuring that they are not alone by having a trusted friend or family member check in on them regularly. This can help to reduce the person's risk of acting on suicidal thoughts and can provide an opportunity for intervention if needed. It's important to be mindful of the person's needs and to respect their privacy. Staying with the person or ensuring they are not left alone can be a way of providing comfort and support, and can help to create a sense of safety and security during a difficult time. 5. Create a safety plan. Creating a safety plan is an important step in suicide prevention. A safety plan can help a person who is at risk of suicide to identify coping strategies and resources when they are feeling overwhelmed or suicidal. The plan should be developed together with the person and should outline steps they can take to stay safe. The safety plan should also include emergency contact information, such as the phone number for a crisis hotline or the nearest hospital. It's important to remember that suicide prevention is everyone's responsibility and that reaching out to someone who may be in crisis can save their life. We hope this video has given you some valuable insights into suicide prevention. Remember, if someone you know appears to be in danger of harming themselves, don't hesitate to reach out for help. There are plenty of resources available to those who need them. Does suicide ever cross your mind? What did you do to overcome it? Share your story in the comments section below. Please don't forget to like and subscribe. Thanks for watching and see you next time.